Pelvic pain, endometriosis, and incontinence are conditions that affect as many as 1 in 3 women. But thanks to a newer form of physical therapy, women now have more options than just living with these issues. Today on Being Well, we're talking about pelvic health, so stay tuned.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
They're the ones who raise the bar. The ones dedicated to providing care in the most demanding of circumstances. The ones that understand the healing benefits of kindness and compassion. They're the people of Sarah Bush Lincoln, and they set the bar high. Sarah Bush Lincoln, trusted, compassionate care right here close to home.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
Thank you so much for joining us today for Being Well. I'm your host, Lacey Spence, and today we are talking about pelvic health, and our guest today, we've got Doctor of Physical Therapy, April Ritz from Sarah Bush Lincoln Hospital. How are you today?
I am doing great.
Fabulous. Thanks for coming on. And just since you're a first-time guest, why did you want to get into physical therapy?
Well, I actually was in physical therapy throughout junior high and high school for several knee injuries and sports accidents. So that's what kind of drew me into physical therapy in the first place.
I feel like that's kind of a trend I've seen with a lot of doctors. They've dealt it within themselves, and so they want to get into it.
Yes.
So today we're talking about pelvic health. So first off, what is pelvic health rehabilitation?
So pelvic health physical therapy is a subspecialty of physical therapy. So physical therapists are considered experts of the musculoskeletal system. Okay. So we treat anything that deals with muscles, ligaments, connective tissue, the nervous system. So pelvic rehab is a focus on the pelvic floor itself. So we treat anything that deals with the abdomen, the pelvis, the hips, the low back, anything like that. So just like other muscles in the body can be injured, so can the pelvic muscles.
And I see you brought your pelvis, so we'll get to that. So who can benefit from pelvic health physical therapy? It's a mouthful.
Anybody can. So everybody has pelvic floors, men and women, including children. So I do see some children, typically once they are 5 years old and above. So I've treated women. I specialize in treating women, and I normally don't see men, but I've seen women 5 years old all the way into their 90s.
That's quite the range there. So what type of diagnosis can be treated with your type of therapy?
So there are multiple diagnoses, and this is an area of physical therapy most people aren't aware of. So I made a long list that we can kind of talk about, but then most people think of pelvic floor therapy, they think of urinary or bowel leakage issues. Okay. And a lot of people don't realize there's help for that conservatively. So we don't do medications, we don't prescribe any medication, it is all conservative treatment, working on the pelvic floor muscles themselves. But we also treat pre and postpartum conditions. So women, while they are pregnant, if they're having like SI, which is like low back pain, or any abdominal round ligament pain, pelvic pain, leakage, pelvic heaviness, things like that while they're pregnant. And then postpartum, if they had a vaginal delivery or C-section, we can do things with both. So if they had any tearing during delivery or a forceps delivery that injured any of those muscles, we can work with them. Some women will have pain with intercourse postpartum, and I work with those women to help reduce that pain so they can get back to their full sexual life with their spouse. I also work with women postpartum who want to get back to running and their sports, because a lot of women they don't know what's appropriate for how to return to those exercises. And if you do it too soon, and if you're having leakage issues or heaviness or pain, you shouldn't be returning yet. So I work with a protocol I have, getting them back to that exercise. We also treat pelvic pain a lot, and there's a lot of different causes for pelvic pain. So a lot of women I see with pelvic pain is postmenopausal. So hormones are changing, the tissue becomes drier. So working with them on stretching those muscles out, reducing any trigger points they may have. But I also see women in high school and college that just have a lot of stress in their life and are holding the stress in their pelvic floor. So I always kind of compare it to, some women hold the stress in their upper trap or shoulder muscles, and then other women hold their stress in those pelvic floor muscles.
Some people clench their jaws and they don't even realize it.
Yes, so it's good initially just to help them be aware of where they're holding that stress and how to properly relax those muscles for pain. Some other conditions that may cause pelvic pain that have a pelvic floor dysfunction underlying that I can treat is people with endometriosis, PCOS or polycystic ovarian syndrome, vestibulodynia. There's a wide range of conditions that can benefit.
And so how do you get trained to be able to treat all of these different ailments?
So I graduated, physical therapists now have to get their doctorate degree. So I graduated from Maryville University in St. Louis after 6.5 years of schooling. And then pelvic rehab is a whole other specialty. So you have to go to extra training for that. So I have my certification of achievement in pelvic rehab, and I took that course through our professional organization. So it was an additional 3 classes outside of school, plus exams, plus I had to do a case report on a patient. And then once you pass those exams, pass your lab practicals, you can get your certification in pelvic rehab. And there's also certifications for pre and postpartum care. You can get your board specialty as well.
That's quite a lot of schooling. I didn't realize so much went into that.
Yeah, there's always continual learning, more research coming out, so I will always be learning the rest of my career.
And so how common are these pelvic health issues, the wide range that you went through?
So some other ones I even mentioned is like we also can treat like constipation and pelvic organ prolapse, women with separation of their abdominal muscles postpartum. It's actually very common. They say about 50 to 60% of women will have some sort of pelvic dysfunction at some point in their life, whether that's when they're younger, pre-postpartum, postmenopausal. But it is very common, but I also tell people it is not normal. So like with urinary leakage, a lot of people just think, oh, I leak a little bit with coughing and sneezing, or when I lift my kid, I have a little bit of leakage, or I get a really strong urge and have to run to the bathroom. People just think that's normal as you age, and it's really not. Another thing we treat is women who have frequent urgency or frequent having to use the restroom or getting up more than 2 times at night. None of that is normal either. So there's a wide range of treatment we do depending on the condition they're coming in for.
And so as you're talking about having the leakage, that can also be prevalent in children, can it?
Correct, yeah. So we always say 5 years or older because by 5, children should be really well potty trained, and they should be able to control those muscles voluntarily. So a lot of times with kids, it's called giggle incontinence. So like if they're laughing a lot, they might have an accident. Or sometimes a big issue with leakage in children is that they're really constipated, and that is what's the underlying cause of their leakage. So we have to fix the constipation first, and then in order to properly treat the leakage.
Does that kind of take a partnership between physicians at all to kind of diagnose?
Yeah, so a lot of the patients I see, children and adults, are being treated multidisciplinary. So between our urology department, our GI department, OBGYN, some of them are referred straight from their primary care doctor, which is completely fine. So sometimes I try to manage it with medications, and then they come to see me for the muscles, with normally the ultimate goal to be off medications by the time they're done, so they have full control by themselves without having to have medications.
And so as you're going through the different types of therapies, how long can it take to treat some of these ailments? And if it's different for each one, feel free to go through them. And how long can it take to see benefits?
So everybody is different.
Okay.
Just like any type of therapy, treatment, how long we're going to be seeing them for will vary. But normally, I would say if it's urinary leakage or bowel leakage, normally the issue is pelvic floor muscle underactivity or weakness. So with that, it's up to 3 months of therapy, 12 weeks, because it takes 6 to 8 weeks to make improvements in muscle strength. If it's pelvic pain, that is a wide variety. I've had some patients with chronic pain their entire life, pain with sitting long periods, pain with intercourse, anything like that. And that can vary from a month to 3 months. And then typically at 3 months, they are independent in controlling their pain, and they just progress with their exercises at home, and I no longer need to see them.
And so there's definitely a big difference between what you can do in office versus what folks can do at home.
Correct. So a home exercise program is very important, because I tell people coming in to see me once a week, twice a week is not going to get you anywhere unless you're doing what you're supposed to be doing at home. So I typically always give a home exercise program of at least 1 to 2 exercises at the first visit, and then we will add to those as we go and make them harder so people are progressing, whether strengthening or if it's relaxation of those muscles, they're progressing in how they're doing that at home.
And so what do these treatment sessions kind of look like in-house?
Yeah, so the first session is always typically 90 minutes, and people think that is very long, which is normally long for a doctor's appointment.
Depends how long you have to wait.
Yes, and we don't have normally a wait time more than 5 minutes, so we're typically right on. But we do a 90-minute evaluation because I go through everything with them. What's your pain levels like? What's your urinary symptoms, your bowel symptoms? I want to know about diet, fluid intake, activity level, what you do for work. What's your relationship status, medications you're on, past medical history, any surgeries, have you had your gallbladder removed, hysterectomy, if you have children, what were those births like? So I go through all that information in the first session. And then it's a lot of education as well, just educating on the pelvic floor and the muscles and explaining to women what these muscles do so they really get a good understanding of that and what we'll be working on in therapy. And then a lot of handouts as well, so explaining if it is urgency issues or urinary incontinence, explaining bladder irritants. I'll give them a bladder and bowel diary where they have to track everything for 3 days for me and bring that in so I can see, okay, what exactly are you drinking? Is all that Mountain Dew or coffee, is that irritating your bladder or is it not? And then once we go through the education aspect, we will do the exam. So the exam, I am not looking at just the pelvic floor because the entire body is connected. Sure. So I am looking at the abdomen, how is it functioning, what's the strength of that. I look at the back, is there any pain in the back? Is there any SI issues? The hips, what's the strength of the hips? And then once we do a full orthopedic assessment, I will look at the pelvic floor itself. So with that, I'll show the pelvis here.
Sure.
So here's the pelvis, here would be you sitting, spine coming up from here. And then here's the pelvic floor muscles themselves. So there's 2 layers. There's an outer layer and then a deep layer that's like a bowl, okay? So those 2 groups of muscles, the outer and the deep layer that's like the bowl, is the main supportive function of the pelvic floor. So these muscles support the contents above it, so they have to be strong. So like when you cough, sneeze, things like that, a lot of pressure goes through the abdomen down onto those muscles. And if these muscles aren't strong enough to withstand that pressure, they're going to open up a little bit and leakage is going to occur. So one role is sphincter control. So you have your bladder for women, the vagina, and then the rectum that run through these muscles. So it has a supportive role, it has a sphincter role where if those muscles are weak, you're going to leak, whether that's urine or bowel. and then it also has the sexual role. So I always show women this picture, or this model, as well as a picture. It's like, if you look at it from the side, it's a sling that's literally holding up everything. I say it's the pelvic floor for a reason, because it is the floor holding up your trunk.
And so let's say for those of us who carry more weight, does that impact those muscles?
For sure. So I see a lot of women that are like, I've gained, 20, 30 pounds this year, and I notice I'm leaking now. So any extra weight that the pelvis has to withhold, yes, it's going to affect those muscles. So sometimes we will discuss weight loss as part of the treatment plan. And sometimes people are not exercising because those muscles are painful and hurting. So it's kind of like, you got to fix the pain so people can get back to exercising, so then they can lose some of that weight that's affecting the muscles themselves.
And again, just talking about how connected everything is, one problem influencing another.
You got it. You got it.
And so for the patients that you see around here, what's the most common problem that you treat?
I would say probably the most common is urinary leakage. So there's different types of urinary leakage. There's stress incontinence, which is when people cough, sneeze, laugh, and then they're leaking with those because that change in pressure. There's also urge urinary incontinence. So urge incontinence is people get a sudden urge, oh, I've got to go to the bathroom, and they're running to the bathroom, and then they have a little bit of leakage on the way, or they're unbuttoning their pants to sit down, and they have a little bit of leakage then. And then you can have both types as well, which is considered mixed urinary incontinence, where they leak with both coughing, sneezing, laughing, as well as with urgency. So we treat all of those in the clinic. And then I would say the second most common condition is probably pelvic pain.
And it's amazing how you're talking about these issues about leakage and whatnot, and a lot of people don't want to talk about it. They don't even know that you exist to help them out with this problem.
Yes, and there is a statistic that, I don't remember what it is, I think it's like 50 to 75% of women don't even bring up to their primary care doctor or any of their doctors that they have urinary leakage, because they're embarrassed by it. They don't want other people to know. They just think it's something they're gonna have to deal with the rest of their life. And that's why I'm really glad you had me on the show, because I just want to get the word out there that there is help. There's conservative help. You don't have to take medications. It does take work, though. Physical therapy is not an easy, you're going to be fixed in a week or two. You have to do these exercises. You have to build up the strength, and it's going to take time.
And if somebody is wanting to see you, how does somebody go about getting, is it a referral, or how does that work?
So at our clinic, you do have to get a referral to come in and see me for pelvic rehab. So what they can do is just talk to their primary care doctor, or if they have a urologist or an OBGYN, they can also mention it to them. And then they would just get a fax or a script and fax it to our clinic, and we would call them and set them up for their first appointment.
So what makes an ideal candidate for someone to visit you? Like, at what point are your symptoms like that are something normal that will pass naturally, or when do you cross that line?
That's a great question, because I see a lot of people that say, my symptoms started 10, 20 years ago and they weren't that bad, but now they're really bad and I can't manage it anymore. So I say as soon as you can. The longer you go without treating it, the harder it's going to be to fix. So if you start having issues right away, whether that's you're in your 20s, 30s, and you had your first child, and you are 3 months postpartum, and you are still having urinary leakage, address it. Call your doctor's office, get a referral, come in and see me, because the longer you go without addressing it, the harder it's going to be to treat. And I tell people, they don't think about strengthening the pelvic floor muscles. People go to the gym and exercise and strengthen their arms and their legs, but the pelvic floor is just a muscle group of that people don't think of. So that's a great question. If you are having pelvic pain or anything, address it right away before it becomes a chronic issue.
And as you're talking about these muscles maybe not being as tight, are there ever situations where folks, they are too tight, when you were kind of talking about the stress, or can gym time kind of impact that at all? Or
Yes, so a lot of times people just think of like, do your Kegels or your Kegels. People think that's all they need to do to improve their pelvic floor condition, which is not true. So these muscles can be overactive, where they are too tight and not flexible enough, just like any muscle in your body, or they can be weak and underactive, or they can be both. So For overactivity or tightness, that typically comes more with the pelvic pain issue. And sometimes also with interstitial cystitis, it's another condition known as painful bladder syndrome. These people typically have painful pelvic floor muscles, as well as the urinary symptoms of urgency, sometimes leakage. And in that case, their muscles are typically overactive. They have trigger points in them that need to be released and relaxed. But they're also having urgency issues because those muscles are so tight and it's so close to the bladder that it's affecting them, and they feel like they have to go to the bathroom all the time. So it's always important, if you do have pelvic pain, to not start with Kegels right away. You need to relax those muscles, work on down training, and then once those muscles are relaxed and they're not holding the pain, then you can start with strengthening. And going off the strengthening too, everybody just thinks do your Kegels. I always tell people the reason I have a job is because 50% of women do not do their Kegels properly.
Sure.
So people they don't know how to do them. They were never told. They went to a class, or they were told postpartum, do your Kegels now. People aren't taught specifically what to do to strengthen those muscles. So when people come into the clinic, we really focus on, okay, let's do this properly. Make sure you're isolating those muscles. You're not squeezing your cheeks together, your buttocks together. You're isolating just the pelvic floor muscles that need to be strengthened.
Right, because as you're showing us the model that's got the different muscles, you could be working the completely wrong ones and not even know.
Yes, I have patients that come in and sometimes are just frustrated with their condition, and they say, don't tell me to do any Kegels or pelvic floor strengthening because I've been doing it for years and I didn't get any better. And I say, well, let's look at how you've been doing it and making sure you've been doing them properly. And they find out, for all these years I thought I was strengthening my pelvic floor, I was actually just strengthening my butt muscles, and they've been doing it wrong the whole time.
And without getting too into detail, how are you able to tell which muscle group you're targeting? Is there machinery for that, or?
Yes, so we normally do, on the first visit when we do the exam, we just do a 1-digit insertion. We don't use speculum, stirrups, anything like that. And I can really assess the muscles. So I can assess the outer muscles, the deeper inner muscles, just by palpation. And then that gives me an idea of what's going on. Are the muscles too tight? Are they painful? Are they weak? But then for the patient themselves, sometimes I just don't have that mind-body connection to their pelvic muscle, so they need to be able to see what's going on. So one form of treatment we do is called biofeedback, and we can use external electrodes, which we hook up to the pelvic floor muscles, or we can use an internal sensor, and we hook it up to the computer, and we kind of have some games people can play. So it kind of gives the patient and myself an idea of how are they doing with these muscles, so they can see on the screen when they're relaxing. It will give me a number and like a chart, and then you can also see when they contract. So they'll be resting and then they contract and it goes up and then it goes back down, and we can just look at their coordination that way. And it's a really helpful treatment, especially on the second visit when they come back. If they're not getting it, we'll do that for a few visits so they can really get down the coordination and what they're doing with those muscles.
And that process, for folks at home, is that a painful process?
No. So people often think, okay, you're hooking me up to these electrodes, is this going to be shocking me or what? And no, they don't feel anything. So those electrodes are specifically just reading the nerve activity of the muscles. So on the screen, what's showing is the nerve activity. So they won't feel any pain with that. Sometimes another treatment option we have is electrical stimulation. So patients that are extremely weak, or if they have a lot of pain, it is a device we can use with the exact same electrodes, externally or internally. We hook it up to a different machine, and it provides electrical stimulation to those muscles. So with that one, it's not painful, but they do feel a sensation, like a tingling sensation, like a buzzing sensation, and what it's doing is waking those muscles up. So I compare it to patients who've had an ACL surgery. They will get electrodes or little stickers that are placed on their quad or their leg muscle to help wake that muscle back up so it can start firing properly. It's the exact same thing. It's just a different muscle group that we use it for.
Kind of like a TENS unit, maybe?
You've got it. Very similar.
Okay.
Yes.
Gotcha. So in our last couple of minutes here, how rewarding is it for you to be able to walk your patients through something that, again, a lot of people have not talked about or known that there's a cure for?
So women's health therapy is a huge passion of mine, and it's just because the the patients that come in typically have been going for years thinking there's nothing that they can do to improve their condition. So whether it's letting people get back to exercising because they stopped altogether because they were leaking when they were fast walking down the road. So they're like, I'm gonna just stop this because I can't do that. Or helping people get back to playing with their grandkids and lifting their grandkids without leaking. For people that have strong like bowel urgency, they're afraid to go out in public because they're scared they might have an accident in public and they don't want to be embarrassed, so they restrict their life to home. And then also for people with pelvic pain, I have seen women in my clinic that are on the brink of divorce because their whole sexual life has been gone for years because of the pelvic pain. And just seeing all those different conditions, seeing the women improve and get back to where they never thought they could be and getting back to their normal life and normal movement is a huge satisfaction.
I bet. You're making a huge difference here in East Central Illinois. We appreciate you coming on the show. A lot of great information. Thank you, April.
Yeah, thank you, Lacey.
And we will see you next time for Being Well.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
They're the ones who raise the bar. The ones dedicated to providing care in the most demanding of circumstances. The ones that understand the healing benefits of kindness and compassion. They're the people of Sarah Bush Lincoln, and they set the bar high. Sarah Bush Lincoln, trusted, compassionate care right here close to home.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.